Welcome to a new episode of Medicine in 3 minutes. As usual, we go straight to the point. The subject is bravely made clear and often illustrated. Let's start. This is the second part of fascial nerve. Let's review the outline. Definition, anatomic landmark, general layout, extracranial view, root in the middle ear, fascial canal anatomy, intracranial branches, extracranial branches, nuclei, bronchiomotor, salivatory, trigeminal, and solitary. Then fascial nerve proper, greater petrosal nerve, deep petrosal nerve, chorda tympani, and lesser petrosal nerve. As some landmark to understand the fascial nerve: the geniculate ganglion, the pterygopalatine fossa, the nerve, the greater petrosal nerve, the nerve of Stephanus, the chorda tympani, the stylomastoid, the stylotemporal foramen, and brachiomotor branch of facial expression. The fascial nerve start between pons and medulla in posterior cranial fossa and through a canal, the intra-auditive canal going through the petrosal part of temporal bone to reach the anterior side, the anterior wall of the middle ear, inside the petrous part of temporal bone. Let's review the nuclei. Brachiomotor nucleus of fascial proper, the salivatory lacrimal nucleus, the spinal trigeminal nucleus, and the solitary nucleus. For nuclei, there is 2 efferent branches and 2 afferent branches. Efferent branches are going from the brachiomotor nucleus to the muscle of facial expression via SVE fiber, and from the superior salivatory lacrimo-salivatory nucleus to the lacrimal gland through GVE fiber. Afferent fiber are coming from the external ear through GVA to the spinal trigeminal nucleus, and from the 2/3 anterior of the tongue through SVA fiber to the solitary nucleus. Let's start with the efferent fiber coming from the brachiomotor nucleus to the muscle of facial expression. Another view to show the salivatory lacrimal nucleus, the spinal trigeminal nucleus, the nucleus propre of brachiomotor nucleus, and the solitary nucleus. They send branches into through the facial propre and through the intermediate nerves of Brisberg. Both of them, they go inside the internal auditory meatus as a facial propre, intermediate nerve of Brisberg, and the vestibulocochlear nerve. Let's start with the facial nerve proper. The brachiomotor fiber of the facial nerve proper coming to the geniculate ganglion. They pass through the facial canal horizontally, then vertically in company with fever of touch, pain, and temperature. Fever of touch, pain, and temperature going to the ear. This GVA fever of touch, pain, and temperature, they have cell body in geniculate ganglion. On the other hand, brachiomotor fiber coming from the superior salivatory lacrimal nucleus, they don't synapse in the geniculate ganglion. At the level of the pyramid, some brachiomotor fiber go to the stapedius muscle, which hold the foot of stapes. The role of this muscle is to reduce loud sound when that contract with the stapedius, which tighten the stapes to reduce sound in the environment. Clinical relevance. Some people suffer from herpes zoster of ganglion when the process involves general somatic afferent GSA fiber from the air producing herpes vesicle in the air, in the tympanic membrane, or in the external air and middle air. It becomes full of hemorrhagic fluid. The swelling affects other components of the fascial nerve. Compression of brachiomotoris develop hemifacial paralysis ipsilaterally. The name of this syndrome is called Ramsay-Hunt syndrome. Then, brachiomotor fiber migrate together with fiber of pain, touch, and temperature until the styloid foramen. At this level, pain, touch, and temperature, they head laterally through the auricular nerve to come across tympanic membrane and external air. From the styloid foramen, some fiber go to the posterior belly of digastric and styloid muscle and the stapedius muscle of the middle ear. The brachiomotor fiber continue their path toward the parotid gland. They give 5 branches: temporal branch, zygomatic branch, buccal branch, marginal mandibular branch, and cervical branch. Let's review. From the nucleus, from the nucleus prop of fascial prop, fiber are coming together with GVA until the geniculate ganglion. Inside the geniculate ganglion, GVA fiber, they synapse. But SVA fiber coming to the geniculate, they don't not synapse. They go together until pyramid. From the pyramid, brachiomotoris fiber, they give branches to the stapedius muscle, and then together they continue until the temporal foramen. From there, they give branches to the external air and branches to muscle of belly or digastric and branches for the styloid muscle. Brachiomotor fiber, they go to the parotid. From the parotid, they give 5 branches: temporal, zygomatic, buccal, and cervical branch. All these branches are for facial expression. Stapedius muscle inside the pyramid is attached to the neck of stapes. When there is a loud sound, stapedius muscle contract, causing the tilt the foot plate of stapes to restrict the movement, preventing the inner ear from excessive stimulation. It's a protective reflex for higher cell. The muscle contract also when a person talks to avoid to hear much for himself. Chorda tympani. Salivatory parasympathetic fiber coming from the superior salivatory lacrimal nucleus. They are going through the fascial canal until the geniculate ganglion. And from the geniculate ganglion, they follow the canal until the pyramid. At this level, in the posterior wall of the middle ear, there is an opening called posterior canaliculus. This from the posterior canaliculus, salivatory parasympathetic fiber, they go through the middle ear and they exit from the anterior canaliculus. They escape from there to reach the submandibular ganglion. In the posterior wall, there is an opening called posterior canaliculus. In the anterior wall, anterior canaliculus. Test fiber connecting the tractus solitarius jump from posterior to anterior wall. There is test fiber coming from the anterior to the posterior wall. Along with that, salivary also escape. Salivary, along with and tympanic membrane, we see a shade moving in the same way. Hence, the name of chorda tympani. This is the chorda tympani, the shade of chorda tympani in tympanic membrane. What is chorda tympani? It's a branch of fascial nerve, including test fiber and gustative fiber, parasympathetic from the back to the front, and test fiber in reverse. Parasympathetic, they go like this, and test, they go in reverse. Test fiber approach lingual nerve. This is the lingual nerve to supply the test for the anterior 2/3 of the tongue. Parasympathetic fiber will end in the submandibular ganglion to mandibular gland and sublingual gland. I repeat, Chorda tympani starts from the posterior caraculus to the anterior caraculus. There is two types of fiber. There is afferent fiber to the solitarius nucleus, and there is efferent fiber coming to the submandibular gland, the ganglion. Fiber coming from the two-thirds anterior tongue, they go through the lingual nerve. We see that in the lingual nerve, there is three types of fiber. There is afferent fiber driving the test. There is lingual, there is parasympathetic fiber going to the submandibular ganglion, and there is touch, pain, and temperature of the two-thirds posterior tongue, anterior tongue, through the V3, going through to the trigeminal system. Let's review. From the two-thirds anterior tongue, there is gustative fiber going through the chorda tympanic, through the lingual branch of fifth mandibular. Touch, pain, and temperature of the two-thirds anterior gland is going with the fifth mandibular branch to the trigeminal ganglion through the foramen ovale. Let's move to the greater petrosal nerve. To understand the great petrosal nerve, we need to learn about some anatomic landmark. First of all, the superior salivatory nucleus, then the internal acoustic meatus and geniculate ganglion. There is the middle ear, of course, and the petrous part of temporal bone with the foramen lacerum, the foramen ovale, and the foramen rotundum. It ends in pterigo-palatine fossa. There is a connection between the foramen lacerum and pterigo-palatine fossa through the thyroid canal. I repeat this landmark: superior salivatory nucleus, internal acoustic meatus and geniculate ganglion, foramen lacerum, pterigo-palatine fossa, and there is a canal between them, is a pterygoid canal. Preganglionic parasympathetic fiber coming from the superior salivatory nucleus, upper part. Fiber, they go to the geniculate ganglion. They come to the geniculate ganglion. Some fiber go to the fascial probe. Some of them ascend to the medial cranial fossa to jump into foramen lacerum. But they do not relay in the geniculate ganglion. When fiber they come, they do not relay here. They jump to foramen lacerum, and from foramen lacerum, they go to the pterygopalatine fossa. They are accompanied by some test fiber in the bony tunnel of petrous part of temporal bone to emerge in the medial cranial fossa to approach foramen lacerum. Fiber coming as greater petrosal nerve to foramen lacerum. Fiber, they come and emerge in the middle cranial fossa. to approach the foramen lacerum. In the foramen lacerum, great petrosal nerve fuse with the deep petrosal nerve to give the nerve of pterygoid canal, ou Villiers nerve, which end in the pterygopalatine ganglion. The greater petrosal nerve synapse inside the pterygopalatine ganglion. Postganglionic parasympathetic fiber, they go through the maxillary branch to zygomatic branch to reach the lacrimatory gland. I repeat, postganglionic parasympathetic fiber coming from the pterygopalatine ganglion. They go through the zygomatic branch of trigeminal maxillary branch to reach the lacrimatory gland. Let's move to the deep petrosal nerve. To understand the deep petrosal nerve, here's the common carotid artery. Here is the carotid sinus between left external carotid artery and left internal carotid artery. Carotid sinus. From T1 and T2, sympathetic fiber, they go to the superior ganglion. Cervical superior ganglion. From the superior cervical ganglion, post sympathetic fiber, they go to the carotid plexus around internal carotid artery. From there, post-sympathetic fiber, they go to the foramen lacerum and they end as deep petrosal nerve. Inside the foramen lacerum, deep petrosal nerve fuse with great petrosal nerve together to go to the pterygopalatine ganglion as a nerve of the Villiers nerve. Another way to show the middle cranial fossa and carotid canal and foramen lacerum. Here is the foramen lacerum between C2 and C3. And then there is the cavernous sinus, and the carotid canal is between C1 and C2. Let's move to lesser petrosal nerve. A lesser petrosal nerve, it's a branch of glossopharyngeal nerve. 9. Let's review nuclei of the glossopharyngeal nerve. There are 4 nuclei: the trigeminal spinal nuclei, the ambiguous nuclei, the inferior salivarius nuclei, and the solitarius nuclei. There are 2 efferents coming. The first from nucleus ambiguous to the stylomastoid muscle, and there is from the inferior salivary nucleus to the parotid gland. And afferent fiber, touch, pain, and temperature from the pharynx go as SVA and GVA to the nucleus solitarius. We are interested here in this circuit from the inferior salivary nucleus to the parotid gland. Lesser petrosal nerve from the inferior salivary nucleus of glossopharyngeal nerve from this one. Fever coming through the jugular foramen. Fever, they are going to the jugular foramen. This is the floor of middle ear. And in the floor of the middle ear, there is a jugular foramen. Inside of the jugular foramen, there is two ganglions. There is superior ganglion and the inferior ganglion. And fiber coming from the inferior salivatory nucleus are going to the inferior ganglion. And from this inferior ganglion, preganglionic parasympathetic fiber detach from the nerve, and they go through a tympanic caniculus and to constitute the tympanic branch of glossopharyngeal nerve. This is the tympanic branch of glossopharyngeal nerve. To reach the middle ear, they pierce the floor of the middle ear to reach the promontory in the medial wall of the middle ear. Fiber, they go superiorly through a bony inferior tympanic canaliculus. They emerge through the floor of the middle ear through a tympanic nerve branch of 9 to reach the promontory at the medial wall of the middle ear cavity. They make there a network to supply middle ear cavity. In touch, pain, and temperature, they terminate here. I repeat, fiber of touch, pain, and temperature, they terminate in the promontory, in the tympanic plexus, but preganglionaire parasympathetic fiber, they make a separate bundle from tympanic plexus. They recollect, emerge from the anterior wall. They recollect and they emerge from the anterior wall to pierce the thickness of petrous bone in a hiatus of lesser petrosal nerve. This is the hiatus of lesser petrosal nerve. And they emerge in the medial cranial fossa to reach the foramen oval. Then they emerge in inferior temporal fossa to reach otic ganglion. Post-ganglionic fiber go through auriculotemporal nerve to supply the secretor motor fiber of parotid gland. I repeat, from the inferior salivatory nucleus of glossopharyngeal nerve, from here, fiber passing through the jugular foramen, from here, going down some preganglionic parasympathetic detached from the nerve. Preganglionic parasympathetic, they detach from the nerve. Some touch, pain, and temperature separate also from the level of inferior ganglion. It is the inferior ganglion. This is the touch, pain, and temperature. They go together with parasympathetic fiber. And they go through a bony inferior tympanic canaliculus to emerge in the floor of the middle ear and they go through the tympanic branch. This is the tympanic branch of glossopharyngeal nerve, where the lesser petrosal start. The lesser petrosal start from the promontory here. Fiber, they go through a hiatus for lesser petrosal nerve, and they go to the middle cranial fossa to jump into the foramen oval, and they reach the otic ganglion before giving postganglionic parasympathetic secretory fiber to the parotid gland. The yellow is touch, pain, and temperature, and the red one are preganglionic parasympathetic fiber. Inferior salivatory nucleus, inferior ganglion of glossopharyngeal, tympanic caniculaculus, promontory. From the promontory there is a tympanic plexus, and this tympanic plexus, the touch, pain, and temperature, they end at this level. But lesser petrosal nerve start from the tympanic plexus to go to hiatus of lesser petrosal nerve to jump into the middle cranial fossa and go inside the foramen oval to go to the otic ganglion. From the otic ganglion, postganglionic fiber go to the parotid gland. Thank you for watching this episode of Medicine in 3 minutes about the fascial nerve. Would you like to click the button like and subscribe? Your comments are very welcome. Thank you.